Hi, I'm going to talk with you about a condition that I am going to consider you to have called being a glaucoma suspect. If you want a handout on this when we're done, I'll be happy to give you one. During your eye examination, there were some findings that make you suspicious for glaucoma. Glaucoma is an eye disease that if you have it and is left untreated, it can actually cause blindness. If you do have glaucoma though, it's very treatable and almost nobody goes blind from glaucoma if you diagnose it early. That is the challenge. When I look at your eyes, I measured your eye pressure. Around 60% of patients with glaucoma have elevated eye pressure during some part of the day. It is normal for the eye pressure to change throughout the day, and most people have their highest eye pressure early in the morning between about 6 and 8 in the morning. But this means that 40% of people with real, genuine blinding glaucoma never have an elevated eye pressure, and those people are said to have normal pressure glaucoma or low tension glaucoma. The high eye pressure and normal pressure glaucoma patients, however, are both treated with the same treatment, which is to lower their eye pressure with eye drops, laser treatments, or potentially surgery in the operating room. I also looked at your corneal thickness, which is the part of your eye you would put a contact lens on. And the corneal thickness can actually affect the eye pressure measurements that we make. I also looked directly at the drain inside your eye that lets the fluids out of your eye, and I looked at your peripheral vision, which is the part of the vision that's over to the side and the part that's affected earliest in patients who have glaucoma, with using that visual field test where you have to put your chin in the thing and click a button when you see the little dots. I will also look at the optic nerve with a special kind of microscopic camera, and that's the part of the eye that actually gets damaged in glaucoma, the actual optic nerve. And if the optic nerve starts to change how it looks, its structure, then that's a sure sign that the optic nerve is getting sick over time. Thankfully, glaucoma is slow to develop, and that's why a person who is suspicious for glaucoma needs to be seen every 6 to 12 months and have these different tests done so it can kind of make a movie of your eye to see if it's changing. Because if it's changing, then you will be diagnosed as actually having glaucoma and be recommended some treatments. But if it doesn't change, that's the goal of successful glaucoma treatment. So if you're not changing, that either means that you have glaucoma and it's stable for some reason, or you actually don't have glaucoma at all and it just looks like you might, which is why we consider you a glaucoma suspect. If you do have these changes that I described in the side vision or the optic nerve structure, I want to make sure that you are comfortable knowing that there are really good treatments. We will discuss those treatment options if we ever decide to tell you that you have glaucoma. Thank you very much.